My name is Dr. Rod Hughes. I'm a consultant rheumatologist and a general physician, and I've worked at St Peter's Hospital, Chertsey, and the Runnymede Hospital for just about 20 years, so I've got extensive experience in my specialist field, but I also do acute general medicine at St Peter's Hospital, so my expertise runs right the way through rheumatology and into all of general medicine. As a rheumatologist in private practice, the conditions I see most frequently are conditions that involve inflammation of the joints. We call that inflammatory arthritis. The most common of those conditions is rheumatoid arthritis that can present with extreme pain and distress in the joints, and with patients who feel very unwell. At the start of their illness, they're unsure what's going on, and they present to me both for a diagnosis and a management plan. I also deal with a number of other conditions that spread wide across the body through the muscles, through the joints and into the bones. So I deal with osteoporosis, a thinning of the bones that happens to both men and women, but predominantly to postmenopausal women. I deal with a lot of soft tissue injuries that come either from sports or from the general wear and tear that accompanies life, and I also deal with a number of complaints that require joint injections. So a lot of my treatments can be one-off treatments that can cure painful muscles, tendons, ligaments and joints. I also have a number of other complex diseases that I deal with that are to do with the body's immune system and the response that the body makes to outside insults. These can involve inflammation of the kidneys, the lungs, sometimes the heart, quite often the muscles and the joints. So the range of conditions that I treat is quite extensive. As a rheumatologist, we're also often asked to see patients from other disciplines where doctors are uncertain what's going on. They know the patient's ill, but they can't quite grasp the diagnosis. And those are some of the more interesting and complex people that we deal with.